So, a little bit about the development of the urinary bladder and the urethra. Before this, let's just go through this video clip. Right, you know this is a disc, the embryonic disc, right? This is the paraxial mesoderm, lateral plate mesoderm, and the intermediate mesoderm. So, it is developing from the intermediate mesoderm. As you can see, right, this is day 21, and you can see a 3D picture of how the embryo is developing. Like I mentioned, it is made from intermediate mesoderm, derived from intermediate mesoderm over here. Okay, nephrogenic cord. Right. So this is the longitudinal section. You can see this is the cloaca. This is the intermediate mesoderm or the nephrogenic cord over here. So coming first to formation of the kidney, formation of the mesonephros. Okay, this is day 23 of the embryo. This is the pronephric duct, pronephric tubules, and the intermediate mesoderms. This is day 24 of the embryo, right? So you can see over here that the cloaca is divided by this urorectal septum into a posterior anorectal canal and an anterior primitive urogenital sinus. The cranial and the largest part of the primitive urogenital sinus is called the vesico-urethral canal and basically forms the urinary bladder. Now continue seeing the video. Here is your allantois, mesonephros, hindgut part. So day 25, you can see these formations. This is basically the mesonephros, mesonephric duct with the degenerating pronephros. Further, it moves on the day 26. You can see right, can you see this over here? This is the cloaca. This is the mesonephric duct. Now, in cross section, you can see this is the Mohrmann's capsule, mesonephric duct, and the mesonephric tubule. Okay. Now, the cloaca was connected with the allantois, and the lumen of the allantois gets obliterated to form the urachus, connecting the apex of the bladder to the umbilicus. Again, just revise what we did previously. Here you can see again the development of the intermediate mesoderm, primitive this is your cloaca. We have done this before in the previous slide, just this is the revision, right? Intermediate mesoderm where the genitourinary system is getting formed. This is the cloaca. You can see the mesonephric duct being formed. This is the allantois that we're talking about, which gets obliterated to form the urachus, connecting the apex of the bladder to the umbilicus. You can see these formations at the day 26 of the embryo. Here, right. Day 28 of embryo. This is the hindgut part. This is in cross section. You can see the primitive glomerulus getting formed. Now formation of the right. You see this? The metanephric diverticulum and the metanephronic mesenchyme over here. Can you see? This is the development of the kidney branching of the metanephric diverticulum. It is branching further on. Forming the major and the minor calyces. This is the ureter and this is the pelvis of the kidney. You can see these collecting tubules, the minor calyx. Formation of nephrons. Here, these are the nephrons. You can see the metanephric mesenchyme ampulla. Here, glomerulus, forming glomerulus. Here, the primitive glomerulus, proximal tubule, distal tubule, and the loop of Henle. Now, relocation of the kidney. Can you see the kidneys? They are developed in the pelvis. They are going to ascend up. Can you see this? Ureter and the mesonephric duct. The kidneys are going to ascend up. Till the level of the suprarenal glands in a 9-week embryo. Partitioning of the cloaca, as you can see, this is the mesonephros, this is the urorectal septum, cloaca, and this is the cloacal membrane. This is the urogenital sinus. Here, can you see the kidney ascending up? Urorectal septum descending down, down, down. In a 12-week embryo, this is the urachus, urinary bladder, and the rectum, lying posteriorly. Now, coming to the formation of the urinary bladder and the urethra. Formation of the urinary bladder first. Right. You can see the vesical part, pelvic part, and the phallic part. This is the urogenital sinus, parts of the urogenital sinus. Can you see the urorectal has descended down to form the urinary bladder, pelvic part, phallic part. Phallic will form the penis. Mesonephric duct, metanephric diverticulum, the vesical part of the urogenital sinus. Over here. Right. Forming testes. It's the mesonephric duct and the vesical part of the urogenital sinus which is opening into it. See the ureter and the mesonephric duct over here. This is the area forming the trigone. Can you see now? Yeah. The kidneys have ascended up. Formation of the male urethra. Here. Urorectal septum has descended down. Right. This is the rectum. This is the bladder. And here is the penis that is derived from the pelvic portion of the phallic part. Formation of the female urethra in a 5-week embryo. This is the paramesonephric duct. Okay. Kidneys ascending up, urorectal septum going down. Okay. This is the uterine tubes being formed, ovary, vestibule, and the vaginal part. Right. So hopefully you've understood a bit about it, about the development of the urinary bladder. Yeah. So, like I said before, that the lumen of the lentois gets obliterated to form the urachus, connecting the apex of the bladder to the umbilicus. Now, this ligament is called the median umbilical ligament. This trigone of bladder is formed by the absorption of the mesonephric ducts and it is mesodermal in origin. Now, now with time, this mesodermal lining is replaced by the endodermal lining. So, the epithelium is wholly endodermal while the muscles are of splanchnic origin. Now, the vesico-urethral canal that was formed by the endoderm forms the anterior wall of the prostatic urethra above the opening of the prostatic utricle and absorb portions of the mesonephric ducts, that is mesoderm, forming the posterior wall of the prostatic urethra above the opening of the prostatic utricle. The definitive urogenital sinus, therefore, formed by the endoderm, forms the lower part of the prostatic urethra and the membranous urethra. The urethral plate or endoderm forms most of the anterior part of the urethra. Surface epithelium of the glans penis or the ectoderm forms the terminal portion of the penile urethra.